The proportion of visits to the doctors for conditions that may be linked to haze has risen slightly in Singapore. That's according to figures from the Health Ministry. The Singapore's healthcare institutions say that they have sufficient supplies of masks and the medication to cope. Deborah Wong with this report.
Conditions like asthma, bronchitis and pneumonia could potentially be triggered or worsened by the haze that has hit Singapore. The Health Ministry told CNA that on average, 16% of polyclinic visits in the 3 weeks before the haze season were for such medical issues. But this went up to 18% last week, when the 24-hour Pollutant Standards Index, or PSI, reached over 150 at one point. The proportion of visits to the public hospital's emergency departments for such health problems also crept up from 11% to 12%. MOH noted that these conditions could be caused by other factors like viral respiratory diseases. But Singapore's 3 healthcare clusters are not taking any risks. They told CNA their hospitals and polyclinics have stocked up on N95 masks, inhalers and eye drops, and supplies will be increased as needed. One doctor says the haze has literally caused a headache.
Some of my patients with migraine have certainly reported that during the haze season, their migraines seem to have worsened. Persons living with migraines are very sensitive often to surrounding odors, and in addition, some patients with migraine also have sinus issues. So certainly these air pollutants may trigger sinusitis and in turn trigger migraine attacks.
Dr. Ong says they can reduce the risk of attacks by avoiding intense outdoor activities during the haze period, drinking enough water, and sleeping and eating at regular times. Dr. Ong's clinic is part of the National University Health System. To protect patients, the cluster told CNA it has installed air purifiers at its healthcare institutions and also redeployed some vulnerable staff to work indoors. Over at one private clinic in Toa Payoh, it says it has also seen a spike in a number of haze-related ailments, such as cough, flu and eye irritation, particularly among the elderly and young children.
Some patients who come in complaining of a flare of their eczema. So most of these are triggered by the haze itself. Things like aggravation of one's prior conditions such as asthma or chronic obstructive pulmonary disease, or even simple bronchitis in younger patients.
Dr. Chang says he's had to bring in more medication such as anti-inflammatory medicine.